Sexually transmitted infections, how they are transmitted, how to get tested, and how to treat them. Today we will cover absolutely everything you need to know to protect yourself from sexually transmitted infections. And in case it happens in your life that you catch something, you'll know how to deal with it. You'll also know how to recognize if you're sick with something, and most importantly, how to get tested. A person often feels perfectly fine and thinks that everything is okay, that there is absolutely nothing to worry about. But inside there are certain living organisms that were passed to us during some sexual encounter, sometimes even as long as 5 years ago. And sometimes this leads to consequences that you can't feel until, for example, 10 years later when you start having problems with your urethra and it becomes narrower. Sometimes this leads to infertility and sometimes to pain that you can't even associate with these sexually transmitted infections. For example, inflammation can cause chronic changes in pelvic organs. That's why today we'll discuss sexually transmitted infections. It's very important for us to understand that the transmission route for these infections is through close contact of mucous membranes, which gives the pathogen the most direct and simple way to enter our body where it normally shouldn't be. That's why there is flora that is normal, and you should never believe specialists who say there shouldn't be any flora at all. Even men have their own flora. And in the urethra, in the urinary canal, there can be a small concentration, as well as on the foreskin, on the glands, and in women too. For example, Escherichia coli can be present in a certain amount, so it can be found in small quantities in the secretion of the prostate gland as well. Some pathogens can be present, and we usually treat those that cause symptoms, that are pathogenic, and are found in large quantities. But the most important thing to understand is that all these infections are very different, and those that live inside us know how to hide from our immune system. There are some that reproduce, for example, on the surface of the epithelium, some that affect the lymphatic system, and some that are able to remain in the body for years in an inactive state. And until the immune system weakens, we don't even know about it. You probably know about such sores. You've probably seen it yourself. Herpes, for example. Herpes can stay in the body for years without you knowing, and then suddenly, after you catch a cold, it appears. Why? It's not because it just appeared, not because the wind brought it, but because the immune system stopped holding it back. That's exactly why. Diversity, World Health Organization stands for the World Health Organization. In the current European guidelines, there is a rather strict logic, regardless of how faithful a husband or wife you are. The World Health Organization recommends that everyone, including you, get tested for the main sexually transmitted infections once a year. Hello, friends. Let's go over the main things. I think this information will be useful for you. First, how sexually transmitted infections are transmitted. The mechanics of contact. Everyone seems to understand, yet I still meet people who are confused about something. When two people have sexual contact, their mucous membranes touch and come into direct interaction. That's why there are contraceptives, barrier methods of contraception, which basically create a barrier between the two mucous membranes so that there isn't this direct interaction. Although it's a paradox, a huge number of sex workers continue to provide intimate services to men who firmly believe that you can't catch anything from oral sex. And then, after getting some kind of infection from her oral cavity, they bring it home and pass it on to their wife. That's why any mucous membrane, again, the mucous membrane is not a skin barrier. Skin is tough, coarse, and knows how to protect itself. The mucous membrane is thin, rich in blood vessels on the inside, and covered with cells that are constantly renewing. At the moment of arousal, when there's a strong rush of blood, they become more permeable. I have a Telegram channel, it's free, and there's a huge amount of useful information that I personally post there every day, usually one post a day. Subscribe to it, it's free and very useful. The link is below this video. There are no other channels like this. If your partner is infected, it doesn't matter how good they look. What could she not have? I've seen plenty of these stories when I worked as a paramedic, when they brought in a girl you would never think could be sick with anything, but she had human immunodeficiency virus, hepatitis C, and even traces of syphilis. Somewhere on vacation, she had a bad night out with someone while drunk, and then she comes back wearing a fur coat and carrying an expensive phone. You can't judge by appearance and think that only unmarried or promiscuous people get sexually transmitted infections. Sometimes it can be someone you'd never suspect in your life, and often they don't even know about it themselves. And the microorganism often gets ideal conditions for transmission. It's warm during sex, it's moist, there's contact, there's friction, and microtraumas occur. The ideal conditions for contaminating the main routes are vaginal contact, which is classic sex between a man and a woman, and oral contact, which is also included here. It's especially dangerous because it's a traumatic type of contact, and the risk of getting human immunodeficiency virus infection is particularly high with it. There's also a special receptor there called CD4, and that's why when it comes to non-classical anal sex, people say there's a risk of human immunodeficiency virus infection. Is there a theory that it was specifically created so that homosexuals would infect each other? Indeed, during anal sex, the chance of contracting human immunodeficiency virus is much higher than during classical sex. Contact of mucous membranes with secretions, meaning it's not always direct contact. Sometimes secretions alone are enough, and although it's extremely rare, it does happen. This includes hands, if there is a fresh infection or damaged skin. For example, kisses. Listen, let's say human immunodeficiency virus, it's even present in saliva, but there's just so little of it that it can't infect you. Kisses, if, for example, you have chapped lips, bleeding gums, or, excuse me, if you're with a woman of easy virtue who just had a client with gonorrhea or syphilis, you can catch all of that. Human papillomavirus, the human papillomavirus, is the most common infection. Where do you think it's most often found? I see that especially in the East, where there's less traditional sex. Yes, because you have to maintain responsibility. It's a paradox. Nobody talks about it, but there are actually more of these kinds of infections there. Why? Because there, for example, among Arabs, if we look, one of the main ways the infection spreads is actually through contact with household items. You can get infected in places like a sauna or bathhouse. Sometimes a husband tells his wife, but it happens. But this is extremely rare, because all these infections are very unstable in the environment. They need certain conditions to survive. What's important to know is that some infections can be transmitted even when using a condom, because it doesn't cover the entire surface of the skin. If the infection is on an area that isn't covered, transmission is possible, especially when someone removes the condom with their hand, secretions get on the hand, and then they put a finger inside the condom, then touch things, and then there's petting, they lie together, hug each other after sex, and as a result, the infection actually gets transmitted. Let's go over the main types of parasites that exist, the ones you should know about to understand the symptoms and how to treat them. The first infection is quite common. Like in the song, yes, Lydia has chlamydia. Do you remember that song, right? This is an intracellular parasite, and it's quite tricky because it lives inside the cells of the urethra as well as in the cervix and the appendages, and it's notable for the fact that it almost never causes any symptoms at all. So you can live your life, not worry, and nothing bothers you. But it slowly destroys tissues in men, affecting the urethra and the prostate. It can cause dull pain in the groin, discomfort during urination, and strange sensations like tickling in the urethra. In women, it can cause tubal infertility, meaning the fallopian tube sticks together, leading to infertility, and often there may be no other symptoms. The second one is gonorrhea. Gonorrhea is exactly what is often described in jokes. When it burns, as they say. Eddie Murphy had a sketch where he said, "I peed fire."
You know, Doc, what does it mean if I go to the bathroom and it feels like the tip is on fire? Well, let's figure it out. Do you feel burning when you urinate? Flames coming out of the tip? When I want to pee, I can't even do it. I'll burn the whole house down. I have to go outside into the yard.
This is a classic severe infection that causes purulent discharge. It's really characteristic, kind of greenish on your underwear. Very often and in large amounts, it just pours out. You can't mistake it for anything else. Urinating is very unpleasant, like you're peeing razor blades, but for some people it can actually be almost unnoticeable. Gonococci develop resistance to antibiotics very quickly. This is one of the global problems. And another issue with gonococci is that they have certain features. Not many people know about this, not many people talk about it. Long-term consequences if left untreated, especially after 10 to 15 years, sometimes even after 20, are serious. The urethra can eventually close up, and the entire urethra, the whole urinary canal, can be affected. What's next in terms of prevalence? Probably trichomoniasis. Have you heard of it? No, it's a protozoan infection. It's a parasite that can attach itself to the mucosal cells and causes frothy discharge. If it's frothy, that's trichomoniasis. It also has a smell. There's often discomfort. By the way, it can also be asymptomatic depending on the amount, but frothy discharge is a sign of it. Another common one is probably mycoplasmosis. Mycoplasma, ureaplasma. These are complex bacteria. They're called bacteria parasites. In small concentrations, they can be normal. Many people don't treat them if there are few and consider them part of the flora. Yes, you got them. They contaminated you. If there are no symptoms, leave it alone, but active reproduction causes chronic inflammation. It's about concentration. Remember what I said, we're not aiming for sterility. In this case, we're focusing on concentration. And if your immune system is weakened, you're sick or lacking vitamins, everything starts to multiply and symptoms appear. The big problem with them is that they're very hard to treat and their resistance is increasing rapidly. What appears on your lip, and sometimes not just on your lip by the way, is herpes simplex virus, 2 herpes simplex virus, 1 in the lab. When you get tested, it's visible. This virus is usually present in the body and many people have it. It can spread without symptoms. Infecting a small child without immunity is especially dangerous, so please avoid bringing many relatives to see them until their immunity develops. And don't say, oh, what a cute 2-week-old baby, and never kiss them, especially if you have herpes. If it appears, under no circumstances should you do that. It can cause damage to the child's central nervous system and may leave the child disabled. Indeed, if it goes into its active form, it spreads very easily, even without symptoms, and it doesn't take much. Especially when you see these blisters appear, these vesicles, these blisters, they are full of viral particles. That's why a person can easily infect you, especially if these have already come out and you can see them. The most common thing, probably the one you ask about most often, is the papillomavirus. How can it be cured? Most of the time it can't be cured unless it goes away on its own, because 80% of people encounter it at least once in their lifetime. It's transmitted quite easily, especially if your immune system is weakened, and there are many types of human papillomavirus. The dangerous ones cause cervical cancer, rectal cancer, and penile cancer. Or oropharyngeal cancer, it's spread even with minimal mucous membrane contact, but the body can handle it. But if it happens that your body can't handle it, you often become a carrier, and at times when your immunity drops, certain risks arise. So if you can't get rid of it, keep the titer low. Syphilis is very well known in many literary works, in books. It has left a big mark in history. This is Trypanemma pallidum. It's a Trypanemma bacterium that always goes through 3 stages. I recently watched the movie Frankenstein, and one of the characters there was suffering from syphilis, and syphilis was actually killing him, and he was trying to help Victor Frankenstein create Frankenstein. He planned to transfer him into that body since he was dying of syphilis, but didn't do it. Because he said that absolutely everything in your body is affected by syphilis, including the brain. There are several stages: the primary ulcer, the secondary rash, and the tertiary stage, which is damage to the organs of the nervous system. By the way, the main character had exactly the same thing, syphilis. Nowadays, many people think it's some kind of atavism and that it doesn't even exist anymore. There was a period when it almost disappeared, but according to statistics, because it's often diagnosed too late, it started to come back, so be careful with your sexual contacts. Syphilis, if you get sick with something or think about getting checked. And many people go and don't get tested for syphilis, saying, why bother, there's no syphilis anymore, it's not seen these days, just test me for Mycoplasma gardnerella. No, you need to get tested. There's also Gardnerellosis. Gardnerellosis probably doesn't need to be mentioned now because it's considered a normal part of the female microflora. It often has a characteristic feature, a fishy smell. Yes, that fishy smell is probably what you need to know. That's Gardnerellosis. A fishy odor from the vagina usually indicates vaginal dysbiosis. Why do most people ignore the existence of sexually transmitted infections? Because they often have very mild symptoms. If every infection caused strong symptoms, probably fewer people would suffer, get sick, or transmit them. Why were virgins valued in the past? Why? Because a virgin didn't have a sexually transmitted infection, that idea evolved over time. Ultimately, it was the absence of such infections in virgins that was most valued. It often happens that there are no symptoms, or sometimes just a slight tingling that goes away, a minimal burning sensation that seems like it will pass. So, if just one drop comes out in the morning, it goes away. The smell appears and then disappears. That is, it basically allows a person to live their normal life, to keep infecting others, because often, including men, yes, we always say that women transmit it, but actually men are mostly the main source of infection. That's why many people blame all this on symptoms, discharge, and everything else, on being tired, on stress, on uncomfortable pants at the gym, on the wrong underwear, on changing laundry detergent, on drinking too much alcohol yesterday, on being sick, and they connect it with those things, not with sexually transmitted infections. And year after year they notice some symptoms when they're sick and they think it's normal, but it's not normal. It's a reason to go and get checked. The most concerning signs are pain or burning during urination. The second is discharge, which can be different. It can be milky or yellow. With gonococci, gonorrhea causes a purulent discharge, possible odor, groin pain near lymph nodes, and pulling sensations in the testicles. Because of these sexually transmitted infections, cysts can even form in the appendages, by the way, and they can be quite painful. Later, ulcers and blisters can appear on the skin, as well as swollen lymph nodes. But an important point, if you notice a hardened growth on the glands that doesn't hurt, doesn't go away, and keeps getting bigger. This could also be a malignant growth, so you definitely need to get a scraping or a smear on a slide and have it checked, because it's often a serious problem. People often think, because of self-treatment, that it's some kind of dermatological sore. They treat it with topical ointments, and then they end up letting the cancerous process progress significantly. So if you have a sore that doesn't heal for a long time, please go and get it checked. Probably the most important question for many of you is how to get checked, the algorithm, the diagnostics, how to actually do it, and what we, including urologists, use, especially if a person is sexually active. A full screening, as recommended by the World Health Organization, should definitely be done once a year. Even if you're not cheating, that's not the issue. And don't be shy about having your partner checked as well. If you have new partners, you should definitely get checked every 3-6 months, even if you have no symptoms. Every 3-6 months, go and get tested with a mandatory set of tests. But even among us, urologists and andrologists, there is debate, as everyone has a different approach. The first is polymerase chain reaction testing for infections from the urethra or the cervix. And there is also an alternative, less painful than that swab that everyone dislikes, which is to provide a morning urine sample, the first one, for polymerase chain reaction diagnostics. In other words, to bring in your urine. Sometimes that's enough. We check for chlamydia, gonorrhea, mycoplasma genitalium, ureaplasma if there are symptoms, trichomonas, herpes, and cytomegalovirus if necessary. For Gardnerella, it's checked as a marker of dysbiosis, not as a disease, because often men come in and say they have Gardnerellosis. What's that? Save me, help me, I messed around somewhere. How did my wife get infected? I say, don't worry. This is standard, it's normal, it just happened. And many people stop at that. Actually, that's not always enough. Sometimes you also need to get a blood test. That's for syphilis. Syphilis is checked through blood. Wassermann reaction, human immunodeficiency virus, hepatitis B, hepatitis C. These are the things that anyone gets tested for example, when they're hospitalized. Also, sometimes even distinguished people are hospitalized and test positive for syphilis, meaning they've had it before. So it's not always a sign that you're, someone who doesn't care about themselves. Sometimes these are actually people who Some people live carefully, use protection, but still get sick without knowing it. This also occurs with hepatitis C, so we may need to check immune status, immunoglobulin M, and immunoglobulin G. Well, for example, if there's a suspicion of cytomegalovirus 2, I would also add to this list that women need to do a pap test. That's human papillomavirus. Those are high-risk types, especially for women, because of cervical cancer. We've photographed so many people, and initially many had human papillomavirus, a lot of them. So if you have human papillomavirus, you definitely need to visit a gynecologist regularly and check your cervix. And for men, as we said, it's a urethral swab, it's prostatic secretion in case of chronic complaints, and ultrasound of the prostate and scrotum if there are any complications, because cysts can also form and it can be painful. How to treat it, right? How to treat it, the usual classic way. Well, treatment is very simple. It's medication, but I can't name the medications. Otherwise, this video will get flagged on the blog again. That's why you need treatment schemes and algorithms. Of course, the dosage also depends on things like weight and the resistance of the bacterial flora. Here's a simple explanation. It's easiest to discuss which drug classes treat the infection. With this info, you might be able to treat it yourself. The most common infection is chlamydia. Yes, it's treated with antibiotics that penetrate cells. The key is the drug's ability to enter the cell, usually macrolides or tetracyclines. Both partners must be treated, so you shouldn't try to hide it from your partner or from the tetracyclines. Just be honest. Otherwise, you'll just infect each other again and the bacteria will come back. Second, gonorrhea is typically treated with cephalosporin antibiotics, but due to resistance, it should always be managed by a doctor since treatment may sometimes fail. And sometimes they combine it with other medications against chlamydia because these infections often occur together. It's rare to have just one of them, so very often they are given in combination. That means you take one first, then the other. Trichomoniasis, well, here metronidazole and lindazole work well, and it's also necessary to treat both partners. In this case, the active ingredient and the brand name are almost the same. Mycoplasma genitalium, this is a rather complex pathogen and it's highly resistant, so they use macrolides, tetracyclines, or fluoroquinolones. Based on the results, you should check sensitivity to ensure they work, since sometimes they may not. Why is this important? Because very often, unfortunately, some doctors prescribe something that doesn't fit, not from this group. I think this will be useful for our viewers. Herpes. Should herpes be treated? Well, antiviral drugs, the most well-known is acyclovir. The acyclovir group are only effective at early stages and during flare-ups. The virus will still remain in the body, but it is controlled, meaning you won't get rid of it. And probably the most pressing question is about human papillomavirus, human papillomavirus. Why isn't human papillomavirus treated with antibiotics? Remember, viruses, antibiotics are for bacteria, so the treatment is to remove the lesions. For example, if a papilloma grows somewhere, like on the glands or on the foreskin, it should be burned off or removed. And we treat it with immunomodulation, meaning we vaccinate the partner if they haven't been infected yet, or the child if they haven't started sexual activity yet. This is one of the World Health Organization recommendations. We also work on immunomodulation, meaning we focus on things that improve the body's immune response, which helps the body respond better and may even prevent infection upon contact. Syphilis is very straightforward here. It's treated with penicillin drugs. The treatment plan depends on the stage. The more advanced it is, the more complicated and longer the treatment. The most important rule is that both partners are always treated, and that's the biggest problem, because sometimes the person who got sick got infected by accident. Sometimes there's an affair, and they try to hide it again or persuade us. They say, "Tell my wife I have prostatitis, something contagious." That's why, if a couple is treated only halfway, unfortunately, there will be a 100% chance of reinfection. And that's why we call it medical ping pong. It goes back and forth, back and forth. You even end up training her sensitivity. That's why treatment without your partner is absolutely pointless. Here you have to get over yourself. At the very least, try to explain it somehow, smooth things over. We all understand. Is follow-up needed after treatment? That's a common question. Yes, it's preferable because sometimes the flora is sensitive, sometimes it's not, and sometimes not everything goes away. Unfortunately, there are, let's say, hard-to-reach areas. If the infection is intracellular or in the prostate, polymerase chain reaction monitoring, a smear test, and sometimes a blood test are essential. A common mistake is finishing antibiotics, testing 2 days later, assuming all is well, but then symptoms return in 3 to 4 weeks. That's why we wait 3 to 4 weeks after finishing the treatment, and only then, with proper monitoring, can we understand whether you've recovered, whether everything is gone, if it's a new infection, or if the medication didn't work. That's why we look at the quantity and concentration, meaning what and in what amount. As for contraception, condoms reduce the risk again, but they don't bring it down to zero. Human papillomavirus vaccination really works, and even if you get infected, cross-immunization, meaning protection against other strains, will still help you. That's why I recommend it. It's one of the few vaccines that I actually advise getting. I'm usually very neutral, silent, and don't give advice about vaccines in general, but human papillomavirus is an exception. That's probably one of the advantages. I would probably recommend my own child get it before becoming sexually active, especially if it's a girl. Avoid alcohol and drugs when meeting new people, because suddenly everyone looks attractive and different. It's definitely not about her or him. You can't just trust someone because they have a wife or a husband. That's the biggest mistake. Especially when it's a married couple and the wife is cheating on her husband, and many people think, well, she has a husband, so she's probably, or a woman thinks the same about a man. And that's how human immunodeficiency virus sneaks into families and so on. That's why regular screening once a year is important if you're sexually active, even if you have a steady partner. Any unusual sensation, if it's not just a one-time thing that lasts for 5 minutes but stays with you for a day or two, you should act immediately. Go to the doctor and get tested. Surrender, raise your hands and say, where did I go wrong?